If you're failing practice NCLEX questions, the problem is not what you know. It is how you are picking answers. Most students who fail the NCLEX have studied hard. They know the content. They just don't know how to think through the questions the way NCLEX expects. Stay until tip number 7, because that one principle alone is responsible for more NCLEX passes than almost anything else. And it is the thing I wish someone had told me before I sat for my boards. Before we get into the tips, I want to be clear about something. These strategies are not just for the NCLEX. Whether you're sitting for an ATI exam, an HESI, a med-surg final, or pharmacology test in nursing school, the same critical thinking principles apply. NCLEX-style questions show up throughout your entire nursing education. So if you're in any stage of nursing school right now, these tips are for you too. So let's get into it. Tip number 1, content review won't save you. Content review alone will not pass the NCLEX. This is the hard truth that most students do not hear until it's too late. Here's why. You can memorize every disease process, every lab value, every medication, and still fail if you do not understand how NCLEX structures its questions. The exam is testing your clinical judgment, not your ability to recall facts. Think of it this way. If content review was enough, every student who spent months reading their textbooks would pass on the first try, but that is not what data shows. The students who pass are the ones who practice questions relentlessly and read every rationale, whether right or wrong. For every hour you spend reviewing content, spend at least an equal amount of time doing practice questions. That is where the real learning happens, and that is what NCLEX is actually measuring. And in my case, I used UWorld to help me with practice questions. Tip number 2, know your question types. NCLEX uses specific question formats, and if you do not recognize them, you will apply the wrong strategy every time. You will see select all that apply questions, priority questions, delegation questions, and teaching questions. And each one has its own logic. For select all that apply, treat every option independently. Ask whether that option is true on its own, completely separate from the others. Students tend to lose points on select all that apply because they try to compare options against each other. For priority questions, you're ranking patients or actions, not eliminating them. For delegation questions, you are thinking scope of practice. What can an LPN or CNA safely do? For teaching questions, you are identifying whether the patient understood correctly or dangerously misunderstood. Once you can identify the question type within the first 2 sentences, you will know exactly which mental filter to apply, and that saves you time and mental energy across a long exam. Tip number 3, your ABCs plus Maslow hierarchy equals priority framework. When a question asks you to see first, who to see first, or what to do first, you need a reliable framework, not a guess. The 2 most tested priority frameworks on NCLEX are the ABCs, which are known as your airway, breathing, and circulation, and Maslow's hierarchy. Airway always comes before breathing, and breathing before circulation. Physiological needs comes before psychological ones. If a patient cannot breathe, that takes priority over a patient who is anxious. But here is the nuance NCLEX loves to test. If all patients are physiologically stable, then psychological safety, like a patient who is a fall risk or expressing suicidal ideation, moves to the top. Having ABCs and Maslow internalized means you do not have to think about the framework. You just apply it. Memorize the hierarchy, practice applying it to real scenarios, and your priority questions will start feeling predictable instead of overwhelming. Tip number 4, eliminate, don't hunt. Do not walk into an NCLEX question looking for the right answer. Walk in looking for wrong answers. Trying to hunt for the right answer leaves you second guessing because all 4 options are written to sound plausible. But wrong answers usually have something that is clearly off. They're too aggressive, they bypass assessment, they delegate inappropriately, or they offer false reassurance. When you start by eliminating what is clearly wrong, you narrow 4 choices down to 2, and now you are making a much smaller, cleaner decision. Elimination is not a test-taking trick. It is how clinical nurses actually think through complex questions or complex decisions. Tip number 5, the safety filter. When you are stuck between 2 answers, ask yourself one question. What would a safe nurse do? NCLEX is not testing heroic or advanced clinical skills. It is testing safety, competency, and entry-level practice. The correct answer will almost always be the most cautious, most patient-centered, most within scope option. If one answer involves calling the physician immediately before you have even assessed the patient, that is usually wrong. If one answer involves an intervention that is drastic or outside entry-level scope, that is usually wrong. The answer that protects the patient from immediate harm, keeps the nurse within their role, and prioritizes assessment before action, that is your correct answer. Tip number 6, pharmacology suffix tricks. Pharmacology makes up about 15% of the NCLEX, which means you cannot afford to wing it. But here's good news. You do not need to memorize every drug individually. We have our beta blockers, which ends in OLOL, such as metoprolol or atenolol. For this medications, you want to monitor for bradycardia. You have your ACE inhibitors, which end in pril, example, lisinopril or enalapril. These you want to monitor for dry cough or elevated potassium levels. You have your ARBs, which end in sartan, such as losartan or valsartan. They're similar to ACE inhibitors, but no cough. You have the statins, which end in statin. You want to monitor liver enzymes, and you want to watch for muscle pain. We have the antifungals, which end in azole, such as fluconazole or ketoconazole. You want to watch for liver toxicity with these meds. You are not studying pharmacology to become a pharmacist. You are studying it to keep patients safe. Tip number 7, assess before you act, the big one. The single most tested principle on the entire NCLEX is this: always assess before you act. This is true in the real world. Before you intervene, before you call the physician, before you give anything, as the nurse, your first action is always to assess the patient. NCLEX is designed to test whether you jump to action impulsively or whether you gather information first. Nurses who skip assessment and act on assumptions are dangerous nurses. Clinical example: if a patient's oxygen saturation drops to 88%, your instinct might be immediately apply supplementary oxygen. But the correct NCLEX answer is to assess first. Reposition the patient. Check the probe placement. Look at the patient's color and respiratory effort. Verify the reading, and then intervene. If you walk away from this video with one thing, let it be this: assess first always. This is not just for an exam, but even when you're working as a nurse on a unit, you want to always assess. You do not call the doctor without assessing your patient first. Tip number 8, don't change your answer. This is where a lot of us get caught up. Unless you can point to a specific concrete reason, a word you misread, a fact you initially got wrong, do not change your answer. When you read an NCLEX question for the first time, your brain is applying clinical reasoning before anxiety sets in. Your first instinct is usually coming from the right place. Research consistently shows that first answers on NCLEX-style questions are more often correct than second guesses. Read carefully the first time, answer deliberately, and move forward without looking back. Tip number 9, therapeutic communication. NCLEX tests therapeutic communications heavily, not just in psych, but in med-surg, maternal health, and pediatrics too. Giving unsolicited advice is wrong. Offering false reassurance is wrong. Changing the subject is wrong. Asking why questions is wrong. They all shut down communication instead of opening it up. When NCLEX marks correct, reflecting feelings, open-ended questions, acknowledging the patient's experience without judgment. Example, patient says, "I'm scared about my surgery." Wrong, "Don't worry, your surgeon is excellent." Right answer, "It sounds like you're feeling anxious. Tell me more about what's worrying you." Therapeutic communication is not just a test topic. It is a real clinical skill that protects patients. Tip number 10, patient over machine. When equipment and patient assessment are in conflict, always prioritize the patient. If a cardiac monitor shows a dangerous arrhythmia, but the patient is sitting up, talking, and has no symptoms, assess your patient first, check the leads, check the patient, verify the reading. Conversely, if the monitor looks fine, but the patient is pale, diaphoretic, and reporting chest pressure, treat the patient, not the monitor. The machine informs your assessment, it never replaces it. Since we spent time on pharmacology today, I want to mention the resource I put together specifically for this part of the exam. It is a 6-sheet pharmacology bundle in my KadieKloset shop on Etsy. It covers every major drug class tested on NCLEX, the suffixes, nursing priorities, key side effects, and some teaching points, all in one place. The link will be posted in the description below, so head on over to etsy.com, KadieKloset, and grab the pharmacology bundle. That is your 10-tip NCLEX framework. Drop a comment below telling me your biggest NCLEX struggle right now. I read every single one, and your question might become the next video. Subscribe for nursing content built specifically for students and new nurses. Grab the pharmacology bundle in the description. It will save you hours of study time. You are becoming the nurse your future patients need, so keep going.